I'd waited for this day since I got my acceptance letter. I'll never forget opening the box, pushing aside the paper, and seeing it for the first time, my t-shirt. On the front, it says, Yale Midwifery, and on the back, at your cervix. You might laugh, but that shirt represents 10 years of my hopes and dreams. So I pretty much want to wear it all the time. And anytime I wear it out, I invariably have a conversation where someone will come up to me squinty-eyed and say, midwifery? And I'll say, midwifery, and I'll explain to them what midwives are. Why does that matter? Why does it matter if people don't know who midwives are or what we do? It matters because, bottom line, global investment in midwifery saves the lives of millions of moms and babies. Midwives are the key to increasing global access to quality health care for women. We are the key to ending preventable pregnancy-related deaths for women and newborns. And yet only 22% of countries have enough midwives to meet the needs of their moms and babies. I don't know if you're familiar with The Lancet. It's a really highly respected medical journal. And they recently did a series on midwifery. And they found that we improve as many as 56 health outcomes. We provide high-impact, low-cost care, which is why organizations like the World Health Organization are working hard to increase global access to midwifery. So when I say the word midwife, what comes to mind? Barefoot hippies, home births. Yeah, some of us are doing that, but we are so much more. My path to midwifery is the path of the Certified Nurse Midwife. We see women in hospitals and out of hospitals. We run birth centers. Overall, we provide holistic, woman-centered, evidence-based care, and we do it all with low intervention rates and high client satisfaction ratings. In fact, the word midwife literally means with women, and that's the crux of what we do. We're at our best when we are with women, listening, communicating, educating, supporting. The centerpiece of midwifery care is being with women during pregnancy, labor, and childbirth. And research has shown that we can effectively deliver 98% of maternity care. Nurse midwives in the US are also primary care providers. As an aside, if you have health insurance through TRICARE, military health insurance, you can choose a midwife as your primary care provider. We provide gynecological care throughout the lifespan. So all your breast exams, your pap smears, your birth control, from adolescents to the very elderly. We work on collaborative teams with physicians. We write prescriptions. We can care for the newborn for the first 28 days of life, and we can even treat your partner for sexually transmitted infections. We are quite literally with women from adolescence to the grave. And yet, only 9% of American women are choosing midwives. We are safe, cost-effective, and underutilized. There's a saying in the United Kingdom. They extensively use midwives, and they have much better outcomes than our system. Every woman deserves a midwife. Some women need an obstetrician. In most European countries, when you become pregnant, you don't even see the OB unless you have certain risk factors. You see the midwife first. I mean, I'm not bagging on OBs, they save lives, and I have worked with many wonderful obstetricians. But midwives provide the same or better outcomes, and we do it with far fewer interventions. And there's a philosophical difference between the medical model of care and the midwifery model of care. Midwives view pregnancy and labor as natural life events, whereas the medical model of care views pregnancy as a series of risks to be managed, a disease state, and birth as a procedure, which is all well and good if you're high risk, but for low risk healthy women, It's a lot like trying to cut a piece of paper with a saw. I mean, you might end up cutting the paper, but at what additional risk for damage? And in the nearly 10 years of working with pregnant women before coming to midwifery school, I've seen this medical model consistently fail women. I've seen things that have broken my heart and made me deeply angry. I've seen a woman with an epidural wait to push so that nurses could finish their lunch. I've overheard an obstetrician on the phone saying that he would push for a C-section so that he could get out of the hospital sooner. I've seen women bullied and minimized. I've listened to our birth language say things about women's bodies like failure to progress and incompetent cervix. Is it any wonder that some women leave this system feeling traumatized? And when they go out and they speak about their experiences, what are they told? At least you have a healthy baby. American women are enmeshed in a maternity system that's profoundly broken, and they're often left feeling voiceless and without options. I'd like to let their experiences speak for themselves. The sad truth is that in our culture, we're not encouraged to think about pregnancy or childbirth until we become pregnant. And at that point, for a lot of us, we're too tired and overwhelmed to effectively advocate for ourselves. Let's talk numbers for a minute. When I say maternal mortality, what comes to mind? Where do you think it happens? Developing nations? Yeah, that's true, but what if I told you that we spend more on maternity care than any other country on the planet, and we rank 48th in maternal mortality? You have a better chance of dying here in the US than you do in China or Saudi Arabia. And even worse, in a time when virtually every other country on the planet, including those in the developing world, have reduced their maternal mortality rates, ours have nearly doubled. There's a lot of talk about why this is happening, but at the end of the day, we are failing. We're failing poor women who have a higher risk of dying than their richer counterparts. We are failing rural women who often have to drive for hours to seek prenatal care. And we are particularly failing women of color. If you are a Black woman in America, your chances of dying from pregnancy-related causes are 3 times that of your white counterparts. There are areas in this country where our maternal mortality rates exceed those of sub-Saharan Africa. Despite all of our money, all of our technology, half of these deaths are preventable. How we treat our fellow human beings, especially when they're at their most vulnerable, matters. This is more than just a healthcare crisis. This is a human rights issue. What happens to the woman who isn't treated with respect and support? Does she come back for more prenatal care? What happens to the mom who leaves her birth feeling traumatized and goes out into a community that doesn't support her? We can do better than this. We have to do better. Prior to coming to nursing school, I was a doula. A doula is someone who provides non-medical support for women in labor. And when I was training, my teacher told me, women remember births for the rest of their lives. I recently had the great pleasure of working with a 95-year-old woman. She had dementia. She was living in a nursing home. She thought her husband that had been dead for 20 years was out getting coffee. She couldn't tell me what she had for breakfast that morning. But when I told her that I was going to be a midwife, she told me in beautiful detail her birth stories. Arthur Golden penned, "When a stone is dropped into a pond, the water continues quivering even after the stone has sunk to the bottom." When you leave here, I want you to talk to the women in your lives and ask them to tell you their birth stories. I think that you'll find that the water quivers for the whole of our lives. Thank you.